to AMR under One Health concept. Now, when we talk about One Health, really what this means is that it aims at providing a holistic, multidisciplinary prevention and treatment of both human and animal diseases. So this concept actually takes into consideration the interconnections among the different ecosystems that influence, especially the epidemiology of zoonotic diseases. As has been mentioned by the VC in his introductory remarks, it's very unfortunate that though we need to tackle the problem of AMR in One Health, most often there are so many barriers that come into play because people tend to work in silos. And that is one of the problems we have to face. So why do we then need to involve a One Health approach in tackling AMR? One is because antimicrobial resistance is really a truly global problem. It's everywhere, geographically, in ecosystems, and we must tackle it from that point of view. Antibiotics, as we know them, are used in many, many settings. This includes in human medicine, in communities for different purposes. We know we use antimicrobials in livestock as well, in aquaculture, in horticulture. Some of the antibiotics are also used there. And most crucially, the same classes of antimicrobial agents, the same molecules, are actually used in different sectors. And naturally, in terms of evolution of antimicrobial resistance, any use of antimicrobials will select for resistance over time. And the resistant bacteria and their genes do not recognize this kind of ecological or geographic borders. They will go anywhere and affect the different ecosystems. So from a global context, why are we concerned about antimicrobial resistance currently then? One is because we've seen from previous reports in research and also in commissioned investigations and reports, and especially the 2014 report that was commissioned by WHO and the World Bank by Jim O'Neill, that AMR is increasingly becoming a serious global public health threat. We have many, many untreatable infections, and many of us are privy to prolonged care for patients that could not respond to treatment. And over the last 20 years, we barely have a new molecule that has been developed for development of new antibiotics. So we have a rather dry antibiotic pipeline. And among all the different geographical regions, Africa will likely suffer most because of these antibiotic-resistant infections. The information we have currently is that by the year 2050, if nothing is done to intervene on antimicrobial resistance, we may be dealing with nearly 4 million and above deaths annually caused by multi-drug resistant organisms. And you can see also the economic burden. By 2050, globally, we may be losing up to $100 trillion due to cost of treating AMR and other costs that come with AMR. And currently, of course, due to this new information we have and various research outputs, we have a growing awareness and commitment, both politically, professionally, and in the general public. So again, majority of you who are in the area of AMR may have seen this slide, courtesy of WHO and the O'Neill report, that as of now, on the left figure, by 2050, you can see 10 million people may be affected by antimicrobial resistance. And those are very, very huge figures compared to other known causes of cumulative deaths. When you look at the regions, Africa, as you can see, is going to be disproportionately affected by antimicrobial resistant organisms, close to 4.2 million deaths every year if nothing happens between now and 2050. So that's a global view, but what has been happening in Kenya? Previously, until the last 5 years, we didn't have a systematic national surveillance for AMR in place. But what we know is that sentinel studies indicate that there's a huge problem of antimicrobial resistance. Use of antibiotics, especially in domestic animals, is not well documented. We have data, but then it's not comprehensive for all systems. But what we know is that in intensive smallholder and commercial farming systems, there is quite a lot of antimicrobials being used, mainly for preventing disease outbreaks, but also for growth promotion. But the paradox is that sometimes you find overuse of antibiotics in some settings, and yet sometimes some of the populations are not able to access these life-giving antibiotics in some areas. Some of the rural areas so that we go to, people can't access these antibiotics. Yes, they are life-saving for some of the diseases. Based on recommendations from the United Nations group that came up with the Global Action Plan that was then adopted by the tripartite UN organizations, WHO, OIE, and FAO, we drew our own national action plan. And we have 5 major objectives. They're all very noble. But again, most important for us is to be able to implement this in a way that's sustainable and a way that will make a difference for both public health and animal health as well. So I'm not going through the details of this, but it's very, very crucial that these noble objectives are taken into perspective so that as we implement them in a One Health, a truly One Health approach, we are able to help those in public health and those in livestock achieve their goals. But that, again, cannot go unchallenged by the complexity we find ourselves. And this, again, was alluded to in the remarks by the Vice Chancellor, that antimicrobial resistance is such a complicated field, and the epidemiology itself is intertwined and complicated because it involves so many sectors, it involves so many systems. We may find resistance that's being driven from industry. We have resistance being driven from livestock and livestock farming, food animals, companion animals. We have human health that drives out of resistance. And all this, again, intertwined around the environment as well. So as we take into account implementing the National Action Plan, then let's bear in mind the complexity of addressing this and a truly One Health approach. What I want to do is to spend the next few minutes just giving you some of the examples of AMR and the One Health that we have studied before for purposes of understanding how this data can then impact on how we are able to address issues of AMR in public health and in animal health as well. Of course, cholera is not zoonosis, but cholera is such an important disease in our environment because of the fact that it's related to the environment. And what the environment is one sector of the One Health. And the reason why I've highlighted this disease is because at KEMRI, we have studied this disease for the last 15 years, especially the epidemiology, but much more so because recently we started observing extended spectrum beta-lactamase producing Vibrio cholera isolates. And this is for the very first time. We started observing this in 2015. And these particular genes have found their way now to other enteric pathogens. And that's why this is a crucially important pathogen for us. And those of us, of course, in this country are privy to the fact that in the last 5 years, cholera really has become one of the most important enteric infections in our environment, especially in informal settings, and sometimes also in areas where cholera would have been a thing that we didn't think about. We have heard about outbreaks in some of the very, very high-level hotels, and all this because we think that cholera, the Vibrio cholera bacteria that causes the cholera disease, has been able to gain what we call a mobile genetic element, and that's on the left figure here, about 169 kilobases. And we call this mobile genetic element the extended spectrum beta-lactamase plasmid. And with it, it carries genes that cause resistance to extended spectrum beta-lactams. Now, these are a class of antibiotics that often forms the last resort of treatment for very severe diseases, both in humans and in livestock. This has been mainly gained from other enteric infections, such as E. coli and Klebsiella, that are in the same environment. So you can see this interchange of genetic materials and antimicrobial resistance between different organisms in the same ecosystem. Now, this was very, very unusual for us because it's the first time we're seeing this happening. Before that, all cholera isolates were fully sensitive to most of the commonly available antibiotics. Another organism that is typical of One Health and which has also contributed a lot to antibiotic resistance is what we call multi-drug resistant invasive non-typhoidal salmonella. Now, this is a disease that is quite common, especially in young children below 5 years of age in Kenya and even the region, and often kills up to 28 to 30% of children who are not able to access proper care within 48 hours of admission to hospital. And naturally, as we know, Salmonella typhimurium and Salmonella enteritidis are the main culprits in this disease. And that's a zoonosis. This bacterium is a zoonosis. But in our settings, we've observed clearly human-to-human transmission of the non-typhoidal salmonella and very, very high incidence rates in our settings. As you can see, between 166 to 568 per 100,000 cases of person years of observation, dependent on the settings. And we don't really have a zoonotic source, but what we know is that this is another organism that has gained a very versatile mobile genetic element that enables it to be able to persist in the environment and also in patients that be transmitted to cause very, very severe disease in children younger than 5 years of age. And in this particular figure, what we're seeing here is whole genome sequencing depicting the four main lineages of Salmonella typhimurium. And the major one we call sequence type 313 is a fairly new lineage, a fairly new subclade of Salmonella typhimurium that is now very virulent and a major cause of invasive disease. And you can see that it contains a repertoire of a lot of antibiotic resistance, including, of course, beta-lactamase genes, chloramphenicol genes, sulfur, and so forth. So highly multi-drug resistant strains in our environment. Same with Salmonella enteritidis, again, a major cause of disease in young children. And again, some of the lineages, some of the subclades that cause common disease in children are very, very novel in our own environment. And
Professor,
yes,
if please. I can interrupt, there is a bit of a problem with the sound, but also time. You need to take care of the time. We are running out of time now.
Thank you. I'm just winding up now.
Okay.
And if we go to livestock, you can see a lot of antibiotics being used in livestock. Again, this is a big issue when it comes to antibiotic resistance. And some of the antibiotics being used by even the poultry farmers, the farmers that use the small-scale farmers, the same molecules that you find in humans, as you can see in the last column, same molecules that are available for humans. So a big problem in One Health. And when you go to some of these households, in fact, just in the backyard, you'll be able to see some of this evidence of some of the molecules being used. And this is, again, a big issue. And again, that extends to processing in factory. If you sample some of those materials, you'll be able to see resistance to various antibiotics that are commonly available. And this is a common challenge. And as I wind up, we want to be aware of some of the gaps in knowledge. Do we really have representative data on AMR in healthcare-associated infections? Do we really know the economic cost of AMR? Because policymakers understand data. We need to have costs in AMR. Antimicrobial use, again, this is an area we need to take care of. Social, economic drivers of antimicrobial use. Why do people use antibiotics in various settings? Stewardship programs in healthcare facilities and also in livestock settings. Are we doing enough for stewardship? Infection prevention and control. Are we advocating enough for this in hospitals? Are we doing enough in biosecurity, biosafety for animal health? And do we really have a truly One Health approach in AMR as far as the environment is concerned? So, ladies and gentlemen, really, those are some of the thoughts I wanted to share, and I acknowledge all partners that are involved in this work from my end. And thank you very much.
Thank you so much, Sam. I would like to get one or two responses before we move to the next presentation because of time. If anybody has a response, a query, you just raise your hand. Then I'll call out your name and you'll be unmuted. Please. Anybody with a response? Anybody with something? Yeah. I can see 2 participants raising their hands. 3. Let's have the first one. I don't see their names. They're not listed. Yeah. Anybody? The first person. Anybody who wants to speak? Kindly, just say what you want. Hello. Hello. Anybody?
Hello. Yes, I can speak fast.
Yes.
The issue of concern is what the professor has mentioned in regard to use of antimicrobials in livestock production, specifically the claim that they are to blame for the building up of resistance. On one part, I may agree because of the indiscriminate use of antimicrobials due to poor regulation setup that we have in the country. Yeah. But on the other hand, they are really quite necessary. The challenge is how can we enforce rules and regulations that guide use of antimicrobials? And maybe this is a subject that one of the discussants will wish to discuss. Thank you.
Yes, thank you. Anybody else? Before I let Sam respond, anybody else with something that they would like to say?
Joseph Ogola, you can unmute.
Yeah.
Ogola, kindly unmute yourself and speak.
Ogola, yes, kindly.
No, sorry, it was a mistake. Sorry.
All right. Anybody else? Anybody else? All right. Prof. Sam Kariuki would like to respond to what Professor Wahome has just said, the issue of enforcement. How do we go about this? Or anybody else in the panel?
Yeah, I absolutely agree with Professor Home's sentiments. Obviously, most crucial in stewardship is really to balance between use that benefits individuals that require these antimicrobials, and of course, the misuse are part of the antimicrobial use. What we've observed, especially among farmers, is that in animal husbandry, a lot of these antibiotics are life-saving, no doubt about it. But then what happens sometimes is that due to lack of proper information, lack of proper guidance in use of antimicrobials, some farmers may tend to overuse these antibiotics. And any use, as we know, will go to cause buildup of antibiotic resistance. So it's also crucial that that balance is struck by the fact that we offer professional help to farmers. It's the same in health. In human health, we see even people going to buy antibiotics over the counter without prescription. A big challenge. So again, the issue of regulation and enforcement again come into play in both sectors. So it's very crucial that this becomes a truly complementary effort rather than a blame game for either of them. Thank you.
All right, so we'd like to move on to the next presentation because of time. Thank you very much, Professor Kariuki, for that very good presentation. I can see the comments. Everybody seems to be happy about that. So we go to the next presentation, which is by Professor Bibora. And Professor Bibora will be talking about contributions of the Faculty of Veterinary Medicine towards the fight against AMR. Welcome, Professor Bibora.
Thank you. I'm going to talk about the role of the faculty, how they fit into the fight against the antimicrobial resistance.
Yes.
Okay. We have 10 minutes, so I'll rush through it.
Yes, it's a 10-minute presentation. Yes, thank you.
To show that we have the two arms, the human arm and also the animal arm. And that in both cases, our wish is to have them safe so that the farmer gets full production for his income and the human is healthy and able to carry out his job, or if it is in school, they're able to learn better. Now we know that the human depends on the farmer to get proteins. As we can see, the livestock plays a double role for the farmer and humans, and also the country. It provides proteins to the humans. So here we have the issue of the food safety to make sure that the human doesn't fall ill. And also that it provides income to the farmer and also to the country. And here we are talking of food security. So in both cases, when they are sick, both the human and the animal, they need to be treated. And as Professor Kariuki has said, same molecules are used for the bacteria in humans and in animals. Now we find that about 60% of bacteria that affect humans are shared with animals. Though this is more reason why we should have this unified One Health approach. Now, noting the importance of the livestock to the farmer, if the animals are sick and the regular antibiotics are not working, the farmer desperately encroaches on the ones that are reserved for humans. Simply because, of course, he wants to survive and he wants to have his economic importance. Now, as Professor Kariuki has put it, we have reached a stage where most of the bacteria are resistant to most of the antibiotics. And this is a very grave concern, especially when we are talking of life-threatening diseases. And we know that with microorganisms, once one becomes resistant, the resistance factor can be transferred very easily to the other bacteria within the same genus or even across genera. And that even the bacteria that are normal, the commensals that we have in our bodies, they can develop resistance and pass that resistance to the pathogenic bacteria. So again, what Professor Kariuki put across, there is constant transfer of bacteria between the animal, the human, and the environment. And that although normally the animal is the one who is blamed, we find that the human also contributes a lot on environmental contamination, and the poor animal has to get most of it because it normally feeds from the ground, from the environment. This is one of the spectacles sometimes we see around, and this over flow of sewage causes massive environmental contamination. Now, again, Professor Kariuki has mentioned that these bacteria know no borders. Once they are there and they are antimicrobial resistant, they can go across through rainwater, through rivers. Birds carry them across borders. And also we have these cross-border travels for animals and humans. And this makes it very easy to transfer the bacteria. Now, we have also heard that antimicrobial resistance is normally associated with overuse, indiscriminate use, or underuse of antibiotics. So we find that we need to reduce the usage of antibiotics. And much as the doctors will do it on the human side, the vet is the one who is better positioned to work on the farmers. And all of this we need to go about. And the main goal is to do what we call behavioral change in the farmers so that they utilize antibiotics appropriately. Now, Professor Kariuki put this, the national policy. What I want to put across is, as we look at the 5 objectives, where does the faculty of veterinary medicine fit in? We fit into the first 4. Now, if we look at the first one, we find that we prepare our students. So we give them knowledge on the antibiotics, what they are, what they do, what precipitates them, how they develop the resistance. We also warn that as we use the disinfectants, sometimes you can have resistance developing to a disinfectant and you get a co-resistance with the antibiotic. And we also talk about antibiotic residues, which can cause pathology on their own, but also the fact that they are in small doses, they can also encourage development of resistance in bacteria. So this we do in the 2nd year of our veterinary course and also in the 3rd year in pharmacology and toxicology. We also have our alumni who are out there in the forefront to fight against AMR. 2 of them are here. You just heard about Sam Kariuki. We also have Dr. Alan Ezegele, who will talk about it later. And also there is support from the dean, the principal, and the vice chancellor. And as you know, the dean and the vice chancellor are all products of this particular faculty. Now for the 2nd objective, which talks of surveillance and research, so far we have not contributed much in surveillance, simply because we have been doing passive diagnosis and testing for antimicrobial susceptibility on farmers' request. But from now on, we have joined the national activity. There's a national activity on surveillance, which is funded by Fleming Fund. So from now on, we'll be actively involved, and our microbiology lab with the Department of Vet Pathology has been recruited as one of the surveillance sites. So for each faculty, for research, we have quite a number of MSc students and PhD students who have worked on antimicrobial resistance, and these they have published. Currently, we have an MSc and a PhD student who are working on methicillin-resistant Staphylococcus aureus, the MRSA, and we have a PhD student who is working on carbapenem resistance in Enterobacteriaceae. In both cases, we were doing both phenotypic antimicrobial susceptibility and also genotyping for the resistant genes. For the 3rd objective, which talks of infection prevention and control, in veterinary, we normally don't use this particular term, but the principle is the same. And the principle of this is important in animal health as it is in human health, where we talk of hygiene, hand washing, keeping animals in clean environment, and which are disinfected routinely. And also we talk of what we call clean surgery, because normally vets, just like doctors, they have a tendency of covering Once they do surgery, they do a cover-up with antibiotics in case of contamination. So we believe that if you do clean surgery, there'll be minimal contamination, so you don't have to use as much antibiotics. Nutrition and management of animals also fall under this particular objective. And this is taught in the second year, and animal production. And here the reasoning is that if we feed the animals well and manage them well, they can go through the cycle without falling sick. So that way you will not have to use any antibiotics. Good management also includes putting in place biosecurity measures so that again you minimize infection and minimize use of antibiotics. And where the disease has a vaccine, then vaccination is encouraged. These aspects are covered variously in the second, third, fourth, and fifth years of the veterinary course. For the first one, here we are talking about antibiotic stewardship, prudent use of antimicrobials, meaning that we need to treat only when we have got proper diagnosis. And here again, the faculty comes in the second year. We teach about bacteria, characteristics, culture, and identification. We teach antimicrobial susceptibility testing. We teach samples collection, handling, transportation, and storage, and also aseptic techniques. And these are also emphasized in the latter years of third, fourth, and fifth years under medicine, surgery, and obstetrics. Now we have quite a number of our members taking part in the national effort against AMR. I'm not going to read them out.
Yeah,
but
Prof, we are running out of time, Prof.
Running out of time. Okay, they are part of committees.
But finish.
Okay. No, I'm not going to read this one. I just wanted to show that there are a number of that, and that we have gotten we are taking part in the Awareness Week, which is a national awareness. It's a World Week that is set for awareness of AMR. And just to go through it quickly, we have had in 2015, we talked to the students here to tell them about AMR. In 2017, we had a walk and our students took part on that. In 2019, we had a regional meeting and stakeholders signed a commitment to be part of the fight against the AMR. Now, this is the board that people signed, and this is a closer look of the board. And in addition to this, we had a student event where the students competed in essay writing and in skit competitions. And you can see we had our One Health Club taking part. Of course, we are guided by Dr. Abom. I think that is all. Thank you.
Vibora, I don't know whether we are allowed to clap for people online, but thank you so much for that presentation. It was really enlightening. If I could have some comments, one or two, it would be nice. Just raise your hand, we'll see you. If you need to say something. Yes, anybody with a comment, anybody with a response? I've seen something from Professor Nyaga. Maybe it is a good time to say about it. There was something to do with contamination of the environment and how it can lead to spread of antimicrobial resistance. I think Professor Vibora, you mentioned something about that.
Yes.
Or anybody else? Okay. If nobody else is there, then we can go to the next presentation, which is from Professor Mitema. Professor Mitema, Simon, are you there?
Yes, I'm there.
Thank you so much. So we can go to the next presentation.
Yes, okay. Thank you very much. My presentation will be on antimicrobial use and its relationship with antimicrobial resistance. We'll start by giving some background and I'll show some slides. I'll just start by saying that antimicrobial agents are therapeutic armaments indicated to kill susceptible bacterial pathogens when correct dosage regimen are applied. remember the word correct dosage regimen. The main antimicrobial classes include all those that have indicated, and as has been talked by the previous presenters, these molecules are the same as the one you use in man. I'll start by saying that.
On that slide.
Yeah, no, the slide comes later on.
Okay.
Okay.
Okay. I'll start. This is introduction. I'll start by saying that Sir Alexander Fleming in 1921 discovered penicillin, which was the first antibiotic. 10 years later, penicillin was used clinically as a therapeutic agent. In his Nobel laureate lecture, Professor Fleming predicted as follows, and I quote, "The time will come when penicillin will be bought by anyone in the shops. There will be the danger the ignorant man will underdose himself and expose the microbes to non-lethal quantities of the drug, making them resistant. If you have to use penicillin, use correct dose to kill the bacteria." So this was predicted by Alexander Fleming as early as 1920, as early as 1949, 45. And I remember penicillin was the first antibiotic that was discovered. From the time of the clinical use of penicillin, several antimicrobial agents have been developed due to antimicrobial resistance development. Overuse and underuse, as has been mentioned by previous speakers, of various antimicrobial agents lead to the development or emergence of resistant bacterial strains, which can transfer their genes horizontally to other bacteria. A milestone for the various antimicrobial agents development is illustrated later in this presentation. Again, I want to stress again here, the rate of AMR development supersedes the development or the discovery of any new antimicrobial molecule globally. This has been mentioned by Sam Kariuki, and I think in the last 20 years, we don't have any new antimicrobial class. In the last 2 decades, AMR research at the department and faculty has been involved in numerous research activities to contain AMR and link the use of some antimicrobial agents with the emergence of resistant strains or genes of some bacteria. I would like to share with you some of the research activities that has started some of the publications indicated in the presentation below. Now, I think you can see now. The topic is the same, and let me do the presentation. Okay, that is the presentation as per today. Then again, I like to quote again. This is Alexander Fleming lecture, December 11, 1945. When he said, "I've already read up to this," I start with here. Here is a hypothetical illustration. Mr. X has a sore throat. He buys some penicillin and gives himself not enough to kill the streptococci, but enough to educate them to become resistant to penicillin. He then infects his wife. Mrs. X's pneumonia is treated with penicillin. As the streptococci are now resistant to penicillin, the treatment fails. Mrs. X dies. Who is primarily responsible for Mrs. X's death? Why Mr. X, whose negligent use of penicillin changed the nature of the microbe? Moral: if you use penicillin, use it now. So this is something which was predicted as early as 45, that these microbes, when these pharmacotherapy governments, we have to use them carefully.
Yes.
Then this is just a typical bacteria showing the various antibiotics, and we see that the antibiotics can attack the bacteria DNA, like the fluoroquinolones or sulfonamides. They can also inhibit RNA polymerase, like the rifampin, the bacterial cell wall. They can attack the bacteria at the bacterial cell wall, like the penicillins, the cephalosporins, carbapenems, glycopeptides. They can also inhibit protein synthesis via the S ribosomes. And this is where you have a lot of many antibiotics, like aminoglycosides, tetracyclines, macrolides, clindamycin, chloramphenicol, linezolid. Bacteria can also inactivate certain enzymes.
Prof. Mitema, can I interrupt?
Yep.
We
Yes.
can't see the details of your slides. Do you have them?
Oh, no, that one is too small. You can see. Yeah, I agree with you. It's very, very small. You may see. I'm just reading it. I think it's the typical just as illustration to show how the various antibiotics attack bacteria at various parts of the cell.
Okay.
Now,
Then, so
this
we
is
just follow.
Can you see that?
Yeah.
Yeah. This is how the first antimicrobial agent that was used was sulfonamides. That was around 1930, 35. Then came in penicillin. Clinical use was around 42. Developed the arrow at the top shows when resistance started. The bullet shows when the year it was introduced. So as you see, as we use these compounds, over time, resistance has developed. We can only see that erythromycin, which was discovered, which was used from 1952, the resistance was only seen around 1990. So what we're seeing is that the bacteria is becoming very intelligent and they're actually developing resistance to many, many molecules. And that's why, as Sam alluded, we have never had any new antimicrobial agents. And you can see tigecycline, which is a member of the tetracycline, which was introduced around 2006. Just after 1 year or so, it became resistant. So we are running out of, the race is too fast. Bacteria is getting resistance very quickly. This is some of the work that has been done at the faculty. One of the studies that was done was we did an overall surveillance of antimicrobial drug use in human over a 5-year period. And this work resulted in publication in Journal of Antimicrobial Therapy. And if you go to that link or you go to that journal, you'll see that in the humans, the penicillins are the main drugs that are used. Then we also had a study, this was one of the very, very early studies done in the consumption of antimicrobials in food producing animal. And it became the real eye-opener. This work started in 2000. And actually the work on AMR and AMU started just around 2000 time. Then we also have a chapter in a book. We talk about the role of integrated cell and dispensing of antimicrobial agents, the development of antimicrobial resistance in developing countries. What this is talking about, that if these products are not properly regulated, they can actually also lead to development of resistance. Then some of the work that was done in animals, that this time we have few, but tetracyclines is the main drug that is used in the country even now, although these numbers have got very high. Then it follows by sulfonamides, the aminoglycosides, the beta-lactams, and then others. This is in food animals. If we come to humans, you find that the penicillins, extended penicillins, are the predominantly antibiotics that are used, followed by chloramphenicol, followed by the sulfonamides. Then you have the trimethoprim, which is, then you have the tetracyclines, aminoglycosides, cephalosporins. But I believe CEP2, CEP3 are heavily used now. This is an old study, because these are heavily used now because of the very, very useful in other diseases.
Let me interrupt, Prof Mitema, please.
Yes.
Your time is running out, but we also cannot see your screen. I don't know what happened to your screen, but we can't see anything, and your time is just about to go. It's okay. Just finish. Just finish.
Okay. Then some studies that we have done MRSA, methicillin-resistant Staph aureus in dogs, and we have also been able to see it in cattle, in milk, both in goats and also in dairy cattle in the farm, in our farm. We also, I don't know if you can see that. That's a very interesting study that's about TB resistance in Kenya. Sometimes back, I remember I had a cousin who died from very, very early phase of HIV in 1991. At that time, people were sick from TB. They could only be in the hospital 1 month. The cost was very small. But now, I think TB patients, you take a long, long time to treat them. And this is because of resistance. And then my conclusive remarks are, we have observed methicillin-resistant Staph aureus from milk samples from northern Kenya and Periaba in Nairobi. We have also seen ESB strains of E. coli being selected as observed in milk samples, then we would like to, our role as vets or our role as a faculty is to ensure that antibiotics are used judiciously. Only use them when you want to use them. The idea of thinking that you have to use oxytet wherever any animal is sick, I think the vets must stop that, because oxytetracycline is also very, very important because it's classified as a critical antibiotic in man. Then again, I would like to stress here that our role as the vet or as the faculty during the time we're going to teach our students, we should try to restrain them from using third and fourth generations cephalosporins and quinolones. And these should only be used in food animals only after antimicrobial resistance testing, because these groups of antimicrobians are very important in tackling some of the life-threatening conditions. And with that, I close my presentation. Thank you, Mr. Lee. Thank you.
I have a problem because your screen did not show, but we had some of the presentations. I don't know whether the panelists can be able to see the question and answers, because we have some questions that are listed there by the participants. But if somebody has a question for Professor Bitema, this would be a good time to raise it before we go to that. Anybody with something that they would like to ask Professor Mitema? I have like 5 minutes, which I can allow for questions. And if there's something that you like Professor Bibora to respond to, or Professor Kariuki, you can also raise it now before we move to the next level of presentation. All right, there's some question and answers here. There's one from Patrick, who says there is registration in the EU on antimicrobial use in animals. How can the same be adopted here, especially in poultry and dairy? Professor Kariuki, you may want to respond to that, if he's still there, or Professor Vibora or Professor Mitema.
Can you repeat the question?
It says there is registration in the EU on antimicrobial use in animals. How can the same be adopted here, especially in poultry and dairy? The registration on antimicrobial use.
I think all antimicrobials are supposed to be registered before they are approved for use in our country.
So it's already, so there are already regulations on that.
There's VMD is responsible for regulation of any antimicrobial, and even the way people they used. I know our farmers use them just like that, but all antimicrobial agents are supposed to, if they're poultry, if they're for therapeutic, they must be used for maximum 5 days.
All right. All right. The other question is, how do we mainstream antimicrobial stewardship in Kenya in the One Health context? Mainstreaming use, antimicrobial stewardship.
I think that should be handled by Asagele later on. It's very keen on that.
Yeah, Asagele, you come on to that.
Address that.
But there's something else that you can respond to. What is the way forward now that no new molecules have been there in the last 20 years? I think the way forward.
I can answer to that.
Yes.
Hygiene, which Deborah talked about. Let's make sure that we have extreme hygiene. Then things like probiotics, we could use other products, and so that we make sure that we use probiotics for that. And then again, we get away from the idea that every sick animal you must treat with antibiotic. We make sure that AST susceptibility testing is done, that you can only treat when you can be able to know that this animal is infected by bacteria, so that we reduce the amount. That's a very controversial statement, because the industry globally in Europe and America, some of the big companies, when you hear that you don't stop them using that, especially in poultry, because it's a big money maker. So it is very, very tricky, but the whole idea is to use them very, very carefully. Use them, as I said, very, very judiciously. because our role as veterinarians, and that's where public health comes in, our role as veterinarians is to protect man, to protect the consumer. So we don't want a situation whereby we are using excessive amount of antibiotics, which will select for resistant strains of bacteria and genes, and those genes become transferred to man. And if that happens, then our public health concept or our One Health concept will not be achieved. Therefore, our role as veterinarians is to ensure that we use these products very, very judiciously so that they don't select for bacterial strains and other certain genes which can be transferred to man. Thank you.
Okay. There's something else.
Can I add something?
Yes, Professor Vibora.
Yeah, they say if you don't use antibiotics for a long time, the bacteria may revert back to sensitivity.
Mm-hmm.
So the main issue is to try and use it judiciously, and also try and not use it for a long time. Then we have a hopefully that with some time, they may revert back and be susceptible to the antibiotic.
All right. Yeah, the same argument is also forwarded for bacteria, the helminths, anti-helminthic resistance. If you leave the anthelminthic for some time, the parasites are thought to revert back to susceptibility. All right, there's something else here which has been put down. Diagnostic tools are important to aid in informed use of antimicrobials. There is limited accessibility of these in the field of veterinary medicine. Are there any initiatives to better equip veterinary laboratories, mobile labs, and increase access to pen-site tests mashinani?
Yeah.
So he's asking whether there is a possibility of that happening. Professor Vibora, that is your area.
I think that is happening now because, as I said, we have joined in the nationwide surveillance with the Fleming Fund. One of their aim is to capacitate the various labs in the country.
All right. So
thank you very much. Most of the labs will be able to run the susceptibility testing.
All right. Okay. Professor Budia, there's something you have put down here. Would you like to say what you have said, Professor Budia? Professor Budia? He can't hear me. Okay. So he has put down something there. He has a comment here. He says it's a comment for aquatic animals. The human activities, urban and other waterland off and sewage is a big problem. So he reckons that this the water that is coming into where the fish are would be a problem in terms of AMR. Yeah, yes. And he says the Faculty of Veterinary Medicine is also now involved in AMR in fish in Kenya. All right, so because of time, let's move to the next presentation. This one I'll
Professor Micheka was raising his hand.
Oh, Professor Micheka.
Yes, please. I just want to ask one question, please.
Yes, Prof. Yes.
There are farmers at home, really rural farmers who have 1 or 2 cows.
Yes.
And the moment they see a problem, they call a vet who quickly comes with an antibiotic, and invariably they administer that. How is our extension services back there? Really the actual extension services for advisory to the farmers who don't know anything whatsoever.
All right, I think we'll hear about that from Dr. Zegere. Just note the next speaker. You'll be talking about the veterinary directorate.
Okay, thank you.
Yeah, so I think that will come there. Thank you very much. So we move to Dr. Zegere. Dr. Zegere will be talking to us about oversight law of the Ministry of Livestock in the fight against AMR in animal sector and collaboration with the Faculty of Veterinary Medicine. Welcome, Dr.
Thank you, Prof. I hope you can hear me.
Yes, and see you very well.
That's the best you can do because I don't have a presentation.
All right.
Yet also, I was unable to link through my computer. So I'm using the phone. So just as beginning, thank you very much for this opportunity. And I do acknowledge the Vice Chancellor, University of Nairobi, for enabling us to have this occasion and being the guest for today's session. Now, I think a lot has been spoken with regard to AMR, and you will also note that what has been expressed, especially with my previous speakers with their presentations, bring out the key issues with regard to drivers of AMR and also the extent of which AMR and the impact it has had on the general human population and also livelihoods in general with regard to animal health. Now, with all these in perspective, and with other studies which have been undertaken in the country, which I will not go into the details, I'll just say the government, through the Ministry of Health and through also the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, took up this issue very seriously and developed the national policy on prevention and containment of antimicrobial resistance. And this was also coupled with a national action plan, a 5-year national action plan, to implement the policy objectives for the government. These two documents I would bring to your attention for those who have been in the know, were launched in 2017. And the backdrop of this was that Kenya, as you know, is a member of the World Health Assembly, also a member of the Food and Agriculture Organization of the United Nations, and also the member of the World Organization for Animal Health. And these three organizations in 2015 adopted the Global Action Plan, which in those respective sessions of these organizations, member countries, Kenya included, committed to develop their national action plans, which would address this global threat of antimicrobial resistance. Now, with that, Kenya undertook to do the policy, as I'd mentioned earlier, and this, together with the National Action Plan, gave the country the roadmap towards addressing the specific issues in the country. And more so, this was informed by the situation analysis that was undertaken in 2016 by the former speaker, the first speaker, that is Professor Kariuki. He's the one who undertook the situation analysis, and it informed what led to what we put in the policy and the issues that were addressed in the policy and now being implemented through the National Action Plan. Now, the main goal of the policy is to reduce the burden of antimicrobial resistance and promote prudent use of antimicrobial agents to ensure that, for as long as possible, there is continued successful treatment and prevention of antimicrobial microbial diseases with effective, quality assured, and safe antimicrobials accessible to all who need them. Now, the government established the National Antimicrobial Stewardship Interagency Committee, which is at the national level for governance of antimicrobial resistance program in the country. This has the steering committee, which is composed of the line executives, that is the principal secretaries of the Ministry of Health, Agriculture, Trade. You may find it strange that trade is there, finance, environment, and education. These are among the key ministries that are engaged in this steering committee with their technical directors forming the technical committee, and there is the National Antimicrobial Stewardship Secretariat. This is mirrored at the county level by the County Antimicrobial Stewardship Interagency Committee. These are committees that have been established so that whatever policy documents that are developed at national level, they are implemented at the county level because our governance structure is in that manner, where policy is at national and implementation of policy is at the county level. So the coordination of implementation of the national policy on AMR is through this secretariat, which is co-chaired by the Ministry of Health and Ministry of Agriculture. And it involves all the ministries, departments and agencies within government. We have civil society organizations. We have industry professionals engaged. And most importantly, as we are here right now, is a testament that the University of Nairobi has been on the forefront. And from the previous presentation, you noted that the University of Nairobi has been with us from the time we started doing the policy to the time we have developed various activities that they have gotten engaged, and more specifically with the World Antibiotic Awareness Week, which has been renamed World Antimicrobial Awareness Week. Now, with the launch of the National Action Plan and support from various partners, the government has been able to develop a behavioral change AMR communication strategy. Together with that, we have the National Antimicrobial Stewardship Guidelines for healthcare settings, and we also have guidelines for the prudent use of antimicrobials in animals. This document, especially the guidelines for prudent use of antimicrobials in animals, gives the clear stewardship for antimicrobial use in animal health. Further to that, the National Antimicrobial Surveillance Strategy for Public Health and Animal Health has also been developed and currently being implemented through support by our partners, donor partners, especially the Fleming Fund, which is strengthening our surveillance currently. And also there's the National Infection Prevention and Control Policy and Strategy for Healthcare Settings. And we have also been engaged a lot with our when I say tripartite partners, that is FAO, WHO, and OIE, who have supported us, especially FAO, with the, undertaking studies in poultry value chain in Kenya. And this brings out the very, very practical situations that have come out in various presentations from my previous presenters. These have brought out the key issues that we need to address in a practical way and in collaboration with the counties through their CASICs. When I say CASICs, is the County Antimicrobial Stewardship Interagency Committees. So I wouldn't want to go deep into elaborating the massive support we have received, but I would just say, acknowledge there's a lot of support from the Fleming Fund of the UK, which has enabled us strengthen our surveillance. And we are in the process of enhancing our laboratory capacity through our regional veterinary investigation laboratories, together with the University of Nairobi Department of Pathology, which is part of the network of labs that is currently undertaking AMR surveillance. So we are enhancing capacity, and we will be having a lot of AST, that is the antimicrobial susceptibility testing, being undertaken in our regional labs. At the same time, when at the Central Veterinary Laboratory, that is Kabete, we will go further and go into molecular, that is genotypic sequencing for most of the isolates that will be referred to this. Further, we are getting a lot of support also from, as I said, the tripartite, and currently we are just gotten confirmation that we are going to undertake a project referred to preventive approaches to containment of AMR, which will be championed by WHO, FAO, and OIE in collaboration with the government to focus on specific outputs and, more importantly, matters related to preventive approaches with regard to AMR. And this project, if, sorry, I may want to elaborate further, is aimed at ensuring that we have optimal use of antimicrobials in this critical sector, that is mainly in animal health and human health. And we also hope we will be able to improve the understanding of AMR risks and also the specific responses. You will appreciate that AMR is not limited to what the government is supposed to do. It is everybody's business. We got to have all sectors engaged, and that's why we mainly look at it when we talk of a One Health approach. We have the environmental sector, we have the human health, animal health, we have, what do you call them? You and me, let me just put it that way. The youth are very, very important in addressing this matter. We also have a lot of matters related to the farmers. These are key stakeholders who, if you need to get a clear impact on addressing AMR, you must have all these persons engaged and also have their behavior change towards use of antimicrobials. So our focus, I would say, as a government, one is to have everybody engaged, and two, we want to also move further down the chain and get the youth and the young children involved in understanding their role in the fight against AMR, because it's easier to influence the minds of the young than some of us who are already way past being manipulated. So with that, I think I beg to stop. And just before I exit, I would just want to respond to some question I took note of. And that was with regard to the regulations. Rules and regulations with regard to veterinary medicines. I think it has been stated the Veterinary Medicines Directorate is responsible. And with regard, and so far, as I mentioned, we have prudent use guidelines for antimicrobials in animals. Those are documents which are in public domain. And then we are in the process of reviewing our veterinary laws so that we can also more effectively address matters that have a greater impact on AMR. Now, with regard to, what do you call it? There was another stewardship. I took note that stewardship with regard has been fairly well addressed in small animal practice, antimicrobial stewardship. But we mainly in animal health practice in terms of livestock and animal production, we focus more on prudent use, because that is a very, very key aspect with regard to antimicrobial stewardship at that level, because that has been seen as a major driver of resistance. And you'll also appreciate that we, at the government level, we are very sensitive towards the Big Four agenda. And you know very well, AMR would greatly impact on achievement of food security and universal healthcare. And that, I think, in previous speakers, in their presentation, if you look keenly, you'll find that these aspects have come out clear. And also, globally, AMR has been seen to be a great challenge, which could affect achievement of some sustainable development goals, especially on hunger and universal health coverage. Thank you very much, Convener Dean. We can't hear you, Dean.
I'm just saying thank you so much for the presentation. We have some comments which maybe you may want to look at. There's one that says to the DVS, apart from AMR arising from vet professionals, it is sad to say that more than 50% of the cases are treated by quacks. So what are we doing about that? You may want to say something.
Thank you. With regard to that, for sure, we are obliged to report. And as you know, the veterinary profession is regulated by the Kenya Veterinary Board. And therefore, any cases of quacks, people who are not registered by the board trying to masquerade as veterinarians should be reported to the board, and that should be addressed straight away. So let's not just be cognizant that there are institutions which are responsible for the control and regulation of particular aspects of the veterinary profession.
All right. What about sensitization of the public in terms of AMR? Because somebody is asking here, what's the role of the DVS in public sensitization on AMR? What's our follow-up measures in place if by any chance there is surveillance? So he's asking whether the DVS has a role in terms of sensitization of the public. I've seen you participating in what Professor Bora mentioned earlier, but maybe you can elaborate on what the DVS is doing.
Yeah, as was seen in the various clips, the World Antibiotic Awareness Week is one of the events that we hold annually, and it's held globally. In Kenya, it's the government, and more specifically, the Director of Veterinary Services, which is in the forefront in championing the awareness programs in animal health. And so what I would say, we have had several engagements, and we have a strategy of outreach, which we are implementing. And we have had documents which have been pamphlets, posters, small video clips, which we are going to keep sharing on social media and have outreaches. Last year, we had a major outreach to farmers in Kiambu, and we had over almost 400 farmers congregated in Dumberi. So that was during the World Antibiotic Awareness Week last year. And I think it was a very, very major crowning moment, because that's when we reached most of our the general public and the farmers. And also we've had various interviews on TV, which we have been able to reach out to the general public at large. So I would urge everyone, and we are going to host this year's more or less virtually from 18th to 24th. We are planning the events, and therefore we'll be reaching out to all of you to join us and also carry the message on with regard to prevention and containment of AMR, because right now we are looking at the theme of United to Prevent Drug Resistance. This is this year's theme for the World Antibiotic Awareness Week. Thank you.
Thank you so much, Dr. Before we go to the next presentation, I would like, it's okay, Dr. Now we can raise you. Before we go to the next presentation, I'd like to read a comment here from Professor Mbidi, and he's saying, wonderful presentations indeed. And he has commented that aseptic techniques, even in field surgery, maintained at all times to avoid, and he's saying we avoid antibiotic over syndrome. So that is for all of us, everybody who is involved in doing some work with antibiotics. You need to be careful with antibiotics. And that's what all the speakers are saying, including the last speaker, Dr. Azegere. So now we go to the last presentation, we'll have some time for some general questions. So we'd like to go to Dr. Abuom. And if he can spare, he can do it in 10 minutes. Then we can have some few minutes where we can have specific questions asked.
Okay, thank you very much, Dean. Can you hear me?
Yes.
Yeah, we have it very clearly.
Fortunately, there's someone who's just decided to test his vehicle outside my office. So there's a bit of interference, but I'll try to be loud enough, okay? So thank you very much, Dean, for giving me this opportunity. I'm going to talk about One Health activities at the Faculty of Veterinary Medicine and the linkage with the fight against AMR. My name is Tekwero Buomukumu. The outline will be, I'll give a background, I'll talk about pre-service training, postgraduate training, and in-service, the current curricula, as well as some aspects of sustainability. So this has been mentioned before. When it comes to One Health, we always have to think about the environment, the human being, and the animal. And of course, these are all encompassed in one ecosystem. When you talk about One Health, the key activity is workforce development. And this is what has been supported over the past close to 10 years. Through the Office of the Dean, supported by the USAID, and the body that is involved in this is AFROHUN, what formerly was called OSHARE. With regards to pre-service training, we mainly have the student club activities, and we insist on multidisciplinary training. So the training is not just for our veterinary students, but to include students from wildlife, agriculture, medical school, public health, forestry, social sciences, all disciplines, okay, that are relevant to One Health. And you know, there's no discipline that is not relevant when it comes to One Health. So we teach them both the core material when it comes to infectious disease, such as AMR, as well as infectious disease management, but they also taught soft skills, things such as community engagement, communication, advocacy, things that we are more or less sure do not come in the core vet curriculum or the core medical curriculum, but then input here because they're important for us to have One Health practitioners. As you can see on that image, we have students taking part in community engagement in Kajiado, and these are students from multiple disciplines. In addition to AMR specifically, we also have what we call case competitions. And these ones, we hold them every year. There was one held in 2008, 2019, and 2020. Specifically, this was last year's competition, and it was a case competition on AMR. And I'm happy to report that the students from the Kenyan One Health Student Club actually went to win the international trophy, which of course was something that was quite commendable. We also have students who work on innovations, for example, development of mobile and computer applications for tracking antimicrobial use in this country. And of course, this contributes to tackling the problem of AMR. Postgraduate and in-service training, of course, has mainly involved the development of curricula. For example, the one that we're currently working on infectious disease and global health. And there are also short courses that are available on risk analysis, as well as antimicrobial resistance training modules. So the workforce development is not just carried out for undergraduates, there's also training for in-service personnel. And that's why I have this slide here to help to demonstrate that. I also want to remind the members that the faculty has the human resource and laboratory infrastructure to train on AMR. And of course, these undergraduate courses often transition to postgraduate training, and they're very important in reducing the risk of AMR in this country. If I can just remind you, this is related to what Professor Beboro had mentioned earlier. All the courses in the faculty actually are One Health related. and they all contribute to not just being One Health, they all contribute to reducing the risk of AMR. The courses we did in anatomy, physiology, biochemistry, because now everybody's talking about molecular techniques, animal production and husbandry, heart health, preventive medicine, surgery, pathology, parasitology, microbiology, everything is important when it comes to One Health. I know someone was talking about quacks, so topics such as veterinary policy and ethics actually help to reduce the risk of having these people in practice. And that is why we train our students on this. What do you do as a veterinarian that is ethical? When you're treating an animal, do you use less drug than you're supposed to do? Do you just give an injection once and disappear? So all these things are very important when it comes to reducing the risk of AMR. We also have to think about the sustainability of One Health training. And this, of course, is done through various methods. One of them is, of course, curriculum review, as well as curriculum development. And I'm happy to report that 3 cohorts of veterinary student classes have undergone didactic courses or didactic training on One Health. And this, of course, ensures that One Health will be taught hopefully to eternity, as long as the faculty exists. There's also collaboration with partners and regulatory bodies in the development of CPDs. And as I mentioned earlier, some of these CPDs are developed around risk analysis, and some are developed around AMR, gender, as well as other issues. So even if the funder stops funding the One Health training, we still have mechanisms for training on One Health and training on AMR. And this, of course, helps to ensure that this is done in a manner that is sustainable. Some of the challenges, of course, that we always talk about include funding, but we also have to think about uptake of One Health by relevant disciplines. For the most part, we've seen members of human health and animal health taking it up strongly, but we need the environmental component to be handled. To be brought in to actually take up a larger role when it comes to One Health. Because we all live in the same environment and in the same ecosystem. If we just train on One Health for the human and the animal health, and we leave out the environment health, then the cycle is not complete, and we end up with problems as what some of the previous speakers have spoken about. The solid waste management, outbreaks of cholera, and all these other things we're getting as wicked problems in this country. So with that, I think I'd like to end my presentation. It's a fairly short one, as the Dean has requested, but I'd like to acknowledge the University of Nairobi, the Vice Chancellor's Office, and the Dean, as well as the USAID, who have supported One Health training in the faculty for the past 10 years. Thank you very much.
Thank you, Dr. Bom, and everybody for the very good work you've done in terms of the presentations. Now we have about 13 minutes to the end of this webinar. So if there are some issues that you like clarified, this is a good time to do that. Maybe I could get comments from members. Anybody with an issue before I look at the charts? Okay, there is something that Professor Michieka raised, and I don't think it was answered properly or completely. And this was to do with, would you like to elaborate on this? Professor Michieka, you still there? Okay, that one is not there. The other issue that has been raised.
I think I would be able to address
it. Respond to that. Okay.
Yes, I think Prof was keen on the issue of extension services at the village level, and also how quacks end up treating and they're not monitored.
Yes, Dean, and I want to make it very clear.
Yes. Let's give him a chance to say exactly what you wanted to say.
You know, there are people in rural areas who have just 1 cow, 2 cows, 0 grazing, very nice milk cows.
Yeah.
And the moment they see the cow shivering, they call a veterinary doctor from very close homes. They come, inject, go, never come back. And I heard Dr. Bohm saying that they have to do ethical work. Do you have a mechanism of really monitoring those guys who come, work, and then just go? And how is the extension services in vet in this country? Thank you.
Yeah, Dr. Azegele, can respond?
Thank you. I think, yeah, that was what I needed to respond to. You will appreciate that the extension services in the country are in the purview of the county government. And so that service has to be well funded, and all the relevant professionals who need to deliver that service should be employed at the county level. At the same time, extension is not limited to government. We also have now these agrovet outlets who interact a lot with farmers whenever they come to buy various farm inputs. The persons dispensing or selling in agrovets have to be of a particular training, which is regulated partly by Veterinary Medicines Directorate and the Kenya Veterinary Board for the veterinary practice. So for purposes of Prof, the institutions are in place. It's just that now how well functional the county service in terms of extension will vary from place to place. And then also the reach of these institutions that are supposed to monitor the practice and also the trade, how well they reach the various networks to reach the grassroots varies. Thank you. And Dean, if I may just want to clarify something to the participants.
Yes.
I would want people to understand that the One Health is an approach. It's not an issue.
Yes.
It's an approach towards addressing an issue. And for this purpose, we are using the approach to address the antimicrobial resistance as an issue. Thank you.
All right. Thank you. Anybody else with something they'd like to raise?
Yes, thank you, Dean, for opportunity. Yeah, great. Now, the question we need to ask ourselves is, when do we need to use antimicrobials in humans and in animals? Because the time has come, as prophesied by Fleming in his lecture, while accepting the Nobel Prize in 1945, that it will come such a time when penicillin will be available to everybody. And that will be the start of the problems. From where we sit, we are almost, like, remind my students that we are almost getting to the post-antibiotic era. So few antimicrobials are being discovered today. We are not judiciously using the available antimicrobials. So when do we need to use them? What should we do to ensure that we are using antimicrobials when we are supposed to use them? In humans and in animals. That is a big question that we all need to ask ourselves, because it's common knowledge to all of us of what is happening down there. Each and every person now can go and buy an antimicrobial in Nairobi. Send anybody. In any agrovet, anybody can go and buy penicillin, can buy tetracycline, can buy chlorphenicol, any antimicrobial. They are finding their way into us at the end of the day. Withdrawal times are not being observed by the farmers out there. So what do we need to do? Actually, antimicrobials, which are not supposed to be used in food-producing animals, are being used. They are finding their way into our plates. My question is, when do we need to use these antimicrobials And when do we need not to, both in human and in vet practice? Because we all know it is happening. Despite all what is being said, despite all what is being done, they are being used in a non-judicious manner. We are getting to the post-antibiotic era. Already, we have superbugs which are not responding to any antimicrobial which is currently approved for use. Thank you,
very much.
Bonadi.
Yeah, that's a very good comment, and it really kind of summarizes what the problem is, and the responsibility is for all of us because we all play a part. We are educationists at the university. We need to tell our students what to do. I can see one of the students has commented, and she's saying AMR is directly proportional to antimicrobial use. It's an individual responsibility that culminates to collective responsibility when it comes to combating AMR. So we all have a role to play, of course, at the faculty in terms of training, at the DVS in terms of ensuring that things are done properly, and also every arm, but individual people, individual use of these antibiotics is very key that we take care of that. Any other comment before we end? Because at 4 exactly, time, this thing will go off, so we need to take care of time.
I just want to say something.
Yes, Professor.
I want to say that the NASIC, that is the National Stewardship Committee,
yes,
we have all aspects of people. We have pharmacists, we have the NEMA people, we have the fisheries, because we believe that we need to get through to all those people. And
yes,
the main solution is just behavioral change. So we have to keep thinking about it.
People must do the right thing and must be aware that antibiotic resistance is there and it's not going away. Dr. Guta is just saying we are coming to the post-antibiotic era. We are almost there, or maybe we are there. So we need to be careful on how we go about the use of antimicrobials. Anybody else a comment?
Bonadine?
Yes, yes. Just
yeah, yes, I just wanted to comment that we actually have an opportunity to develop new antibiotics through natural products.
All right.
Yes, so I think we should look into that direction as vets and also researchers in the house, that we have quite an extensive resource in natural products. And most of the research that has been done, especially Dr. Joseph Nguta, who is here, has been doing some antimicrobial work using natural products. You can allude to that. They have had very good results, very promising results. So yes, we have a promise in natural products.
It's likely to be our next webinar, the issue of natural products and how it can overcome many of these problems and what the faculty is doing. So thank you very much, Dr. Ochwangi, for bringing that up. Now, I would like us to come to an end here because time has run out. We have only about 3 minutes. I would like to request Dr. Monday to come to bring this to an end by giving a vote of thanks so that we can conclude. Thank you so much, everybody, and God bless you.
Thank you, Dean. Members, may I pass a vote of thanks in a categorical manner because of time. First of all, to the Vice Chancellor, University of Nairobi, Professor Kiama, and on behalf of which institution is celebrating 50 years of existence. And may I request that he also passes the vote of thanks to all the organizers, from the principal, the dean, and all the committees that are involved in coordinating all this, the college level and the faculty level. May I also pass a vote of thanks to the participants, the esteemed participants who have stayed on course and have also posed very stimulating and insightful comments and questions on the topic that has been discussed. May I pass a vote of thanks also to our distinguished panelists, Professor Kariuki, Professor Bebora, Professor Mitema, Dr. Azegele, Dr. Abuom, and all the people who have in the background participated in coordinating all this, the ICT department, the corporate office, and really you have done us all proud. I would like to also, within the remaining 1 minute, to thank God, because we we really are privileged to be part of this 50th anniversary celebrations. And with that, may I pass the mantle back to the Dean.
Yeah, thank you so much, Prof. And thank you, everybody. Mine is to wish you all a good evening and to see you next time. We are going to organize another webinar soon, and we look forward to you being with us so that we can share great ideas. Thank you so much. Good evening.
Thank you. Bye.
Thank you, Brother Dean.
Bye-bye.
Thank you.
Thank you.